So today, again, thank you for being here. We are going to talk about all things wonderful that the Health Center does for our Lamar University. Welcome, my name is Bailey, and I'm going to hand it off to our orientation leaders here today.
Hey guys, so first, thank you for joining us for this meeting. I appreciate every single person that's in here, and I'm just going to go ahead and introduce myself. My name is Madeline Zool, and I'm an orientation leader for this year, and I'm currently a sophomore with a pre-nursing major. And also, one thing that Lamar does to support just mental health is that they bring therapy dogs during the final season. So I really love that. So once y'all come in campus, I really suggest y'all go check that out.
Hey guys, my name is Kelvin Elgar. I am an incoming sophomore majoring in chemical engineering with a minor in business. And stress management is important for me because I'm very involved with campus. I'm trying my best to get a 4.0 all 4 years, and as well as doing internships off campus. And with all those responsibilities, I need to find an outlet, and finding ways to manage that stress helps me keep focus, as well as always bring my A game to all the activities that I do. And before I turn it over to the presenters, I would like to remind y'all that y'all can put any questions that you have. And there will also be, you can put any questions you have in the group chat, and there will also be a Q&A at the end of the session. So please try not to disturb the presentation. And y'all got it.
All right. So thank you everyone for being here today. So my name is Marie Murray. I am the Assistant Director for Health Education at Lamar University Student Health Center. We have two other presenters here today. Dr. Shannon Hicks, you can wave, say hello to everybody, who is our Assistant Director for Counseling Services, and then Nancy Dover, but you'll see her name as Danette. As well, she is the Assistant Director for Medical Services, and she's those two are actually the ones. If you come in for counseling, you may see Shannon. If you come in for any medical appointments, you may see Danette. And then I'm going to be the one you see out doing fun programming and giving away free stuff and doing a lot of, so the OL's brought up some of the stress management stuff. I'm a big part of De-Stress Week, so you'll see me around campus a lot. So we'll go ahead and get started. So just basic information, and we'll repeat this at the end too. If you've seen the campus, you've been to campus at all, the Student Health Center is right next to the tennis courts, almost forgot the word there, and then across from the dining hall. So we're pretty centrally located. And then most of the time, our information is going to be on the website, easy for you to find. But I will say sometimes the easiest way to get a question answered, or you'll find an answer, would be to call, and our number's right there on the page, but I'll put it up again at the end.
Oh, well, hi everybody, I'm Nancy Dover. I am one of the nurse practitioners here at the Student Health Center. Currently, we have about 3 nurse practitioners. We have 3 nurse practitioners, 2 full-time, 1 part-time, and we also have a part-time physician. When you think about the Student Health Center, we really want you to think about it just like you think about your doctor's office. Any usual complaint that you call your doctor's office for, we want you to call us. We can help take care of a variety of symptoms, people who have colds, sinus symptoms, allergies, upper respiratory problems, cough, strep throat, that seems to be a big one, stomach problems. We also care for minor injuries. If you sprain your ankle, your wrist, your shoulder, we can help take care of that. We have a good selection of braces and wraps that we can provide for you. We also are able to take care of minor lacerations. So anyone who has a laceration, generally we can help take care of that, and minor burns. We do have a women's health nurse practitioner that is here on board with us. She can help take care of all your women's health. She does the routine screenings, pap smears. She will take care of problem-oriented gynecological problems. She helps with birth control. We do a lot of physicals. A lot of the programs here at Lamar may require you to have a physical. You can come in and see us and we can take care of your physical. Immunizations, we offer several immunizations such as the hepatitis B, the meningitis, which I'll talk about in just a moment. We have the MMR and varicella, and our nurses can also do titers for those who can't find your immunization records and you need to find out where you are on that. Here at the clinic, we have a small pharmacy here. We can provide you with antibiotics, eye drops, ear drops, creams, anti-inflammatories, and just so you know, we also have some over-the-counter medicine, and you're free to come in and just purchase that on your own. Community resources, we do not offer x-rays right now, but should you need an x-ray, anyone, our staff, the providers can write that order for you, and then they can send you out to a local facility to have that done. A lot of times the students will come in asking for a referral. Even though sometimes we can't do the official referral, we can provide you with the information of the specialists that are available here at the clinic or in the community that you can go. I also wanted to mention we do have lab that we do. We have an in-house lab. We can run a strep screen. We do mono testing. And coming this fall, very excited because we're looking at doing the COVID testing. I think that's going to be something everybody's going to be looking at. So we'll be offering that. And every now and then we'll have someone who just needs to have blood drawn. Our nurses are very, very capable and can get that blood drawn and we can send it out. And usually we have a very quick turnaround time. So, hey, Marie. Immunizations. So right now, the only immunization that is required for you to come to Lamar University is the meningitis vaccine. Now, you're required to have that within the past 5 years. And when you get the meningitis vaccine, it's very important that you get the meningitis vaccine that is the MCV4. This is a quadrivalent vaccine. There is a meningitis vaccine that is available, but it's not going to meet your state requirements. So make sure your paperwork does say MCV4 on there. You need to have it at least 10 days before you come to class, okay? And there are some reasons where people cannot take the meningitis vaccine, and there is an exemption that you can fill out, and you can find that at the Office of Admissions and Recruitment. And the important part here is when you have your meningitis document, you need to email that document to immunization@lamar.edu. And if you forget about this and don't remember, check out our website. You can find it on our website underneath the immunization tab, okay? But, and if you don't remember, just ask in the chat and we'll be glad to share that information. And okay, and one more thing I want to talk about is no, you can advance, Marie, is our COVID procedures. With everything going on in the last few months, we have implemented some changes and some new procedures here at the health center. When you come to the health center for your appointment, we are requiring everybody to wear a mask, okay? When you come in, one of our nurses up front will stop. They will check your temperature and they will ask you about some symptoms and do a small screening. We do ask that you sanitize your hands before and after using our check-in computers. We've made some changes to our waiting room. We have set up our chairs so that you are socially distanced from each other, and we have it separated so that we try to keep any well visits away from the sick visits. At this time, we're not allowing any friends, visitors, or family to come in with you to your appointments. And I'm very excited to announce we are now doing telemedicine. So if you're, for some reason, you want to go that route, all you need to do is just call our office at 409-880-8466, and they can help set up the appointment for telemedicine. And again, if you have any questions, anything about what I've talked about or anything else, just send me a chat and we'll answer it for you. Thank you.
Ms. Hicks, I think you're muted.
Okay, can you hear me now?
Yes.
Okay. So I'm going to go through the screen, and then, like we mentioned earlier, if there are any questions at the end, feel free to ask. We have currently 4 counselors here. In addition to being assistant director of the counseling department, I do also see students. And I have an OPCS, and it's a licensed professional counselor, and that's master level. I do have a doctorate in educational psychology, and I have my LCDC, and that is substance use and abuse license. Rodney is the other LPC, and she also has her LCDC, and that's master's level. And then Cynthia is a master level social worker, and then we also have Ashley, who is a master level social worker. And I'm telling all that so that you become aware that not only we're a part of Lamar University, but we also have been a part of the community and have our community Texas state license. And each of us have over 20 years experience in the community. And in addition to that, have many years at the higher education level, working with a variety of ages and different types of individuals. We welcome absolutely any issues. Please don't wait till it's something that is overwhelming. If you do, that's okay. We welcome that too. But we will see a variety of issues, whether it's freshmen coming in that are don't know what's going on in terms of where you can go. We can help you find resources. We can give you referrals on campus to help you find a support network to begin to build. There are lots of different groups and departments, whether it's study groups or tutoring, organizations that have interest in individuals that like to do activities or talk about the same things that you enjoy, or whether it's fraternities or sororities, sports, all different types of things. We can help you connect with those different support networks. In addition to surviving at college, one of the main things that we tend to work with students on when they come in, they're asking for help with effective communication, assertive communication, getting their needs met, getting their point across, so we can help you better communicate with your professors, friends. Sometimes there's roommate issues, significant others, or family. We also have worked a lot with students in terms of developing resilience, understanding what things can help you build a strong resiliency so that when things come up, you're already set and ready for it in terms of a healthy mindset and other things that are already built in your social environment with support and whatnot. Academic problems, of course, are some of the presenting issues that y'all come in with a lot here, whether it's, like you mentioned, Kelvin, stress management. That is a big, big topic that a lot of students come in with. And along with stress management, there's some time management, study skills, and dealing with things such as procrastination. procrastination, hitting that off so that the anxiety doesn't go up and the distress level doesn't go up. So we're well versed in those different areas. In terms of ADHD, what we have found in the department is that there's individuals that don't even realize that they may have characteristics or a diagnosis of ADHD. And a lot of individuals just keep on keeping on and are able to be successful and move on into higher ed. And then when they get to college, they may need some additional assistance with classroom accommodations, things like where you sit in a room, or being able to get assistance with notes or whatnot. We can test for ADHD and then refer over to the Disability Resource Center and see if there are any accommodations that are available. I did mention the ADHD, however, anything that you're dealing with that you need assistance with or that you've been diagnosed with, whether it's medical or mental health, we can assist you in connecting with whether it's the DRC or other departments on campus and work together as a team if that's what you want. Of course, all of our services here at Student Health Center, medical and counseling, are confidential. The software that we use, it is only in this building. We are a part of Lamar. However, medical and mental health and substance use are protected, and it is confidential and separate from administration, faculty, and other staff. And that is kept in our software, and those notes are for us to utilize in helping track your progress and setting up plans that you want to set up and work towards those goals that you set up. In terms of personal issues, there's a plethora of different issues that students bring to us. Although some of us will have a short stack, 1 or 2 or 3 or 10 different items, just because you may have more than one doesn't mean you have to talk about it. You have a steering wheel on counseling, and you talk about what you feel comfortable with when you feel comfortable about talking about it. So we don't force any conversations, and we're here for what your presenting issues are at the time that you'd like to come in. If you want to just establish a connection where I was mentioning that support network, we're a great place to start and start creating that foundation. There are a variety of different types of counseling that we can help you with, whether it's learning anxiety reduction techniques or mindfulness techniques, where we can focus on the here and now, and instead of really worrying about the past, we can be more problem solving oriented, or let you vent and discuss and share things that you may have never shared with anyone before. So there's just a lot of different avenues that you can pick from when you come in. There's a list on the screen, and it shows some of the more common presenting issues. Of course, mood disorders or stressors and symptoms such as anxiety symptoms that can be physical, or when I say psychological, that's either our thoughts or our feelings. So you may have a variety of different distress categories. Depression that can be anywhere from physical characteristics or worrying or feeling isolated. When I write down relationships, that can be any type of relationships. there's been a stressful one, abusive one in the past, self-esteem issues that a lot of times have come along with that, or family things going on, whether it happened in the past or whether there's financial struggles in the family, COVID-related things, medical things going on. We're a good place to come and be able to vent or talk about it. And it's in a non-judgmental, confidential environment. And another focus we have, and this will help you to see that it doesn't have to be a huge, major issue at the time, is emotional wellness. We do focus on prevention, and so we have a lot of different ways of addressing emotional wellness, whether it's our sleep habits, our nutritional habits, integrating physical activity, socialization is really important. And that really varies whether a person is very outgoing or likes the quiet, peaceful evening. We can help you find different ways of socializing. And so those different areas are some of the main larger presenting issue areas. However, anything that you may be dealing with that I haven't mentioned, we welcome you to bring with us. We're open, we're very inclusive counseling department here, so we welcome any LGBT issues or, like I said, family relationships. It's not just academics, but we can help you whatever you bring to us. In addition to some of the regular standard making appointment and come visit about what's on your mind, we also do crisis intervention. And that's when a person is very worried about the thoughts that they're having, either thoughts of harming themselves or others. We will help you deal with anything that you need to. So if you need to walk in, and because it's at a crisis level, we're here for that as well. We also help students that have dealt with an assault. And so that is one of our specialties, that we can help you through whatever you bring to the table. Let's see, I think I've covered those. And so when we get further down the road, Marie will help us with the questions and answers. Feel free to ask any.
Okay, sorry, had an issue muted. Okay, so for the last section, and I'll try to run through this pretty quick. So on the health education side, I'm basically trying to make it so that you don't have to see Shannon or Jeanette at all. I want to give you guys information so that you can make the healthy choices for you. And so one of the big things that I have is actually have a peer health education program, so that it's not just always dealing with me, it's also working with your peers that they actually go through a training. It's a paid position, and I'll get to that in a minute. But there's a lot of advice that they can give as well from this position, and you can kind of talk to somebody that's on your level that has, is going to school at Lamar. They probably have advice on resources as well. I cover a variety of topics. So there's a couple that I have to do. There's laws that require me to do them, things like alcohol, bystander intervention as it pertains to sexual assault. The cool thing is we do a whole month and we talk about sexual assault awareness. We do activities such as walk a mile in our shoes, and I have a photo from that coming up. But I'll cover things such as relationships, mental health and stress. We just this year added a new presentation, so I offer two, and I'll be looking to add another one. So a lot of the things that Shannon talks about, I will offer these in group settings, in presentations. So if you join an organization, which I highly recommend. You can have me come out and give a presentation to your organization and have this cool educational component to that. I'll cover things such as sexual health, as well as nutrition, and just overall wellness as well. And I try to do kind of big events for me throughout the year so that there's always kind of something going on. So this is just kind of piggybacking off of that previous slide, but what I wanted to highlight was some of our featured events. And so the OLs brought up De-Stress Week and some of the events that we do, and you'll see if you guys have a big enough screen, you can see that one of the things I highlight is the therapy dogs at the library. That's one of my favorite parts too. And the cool thing is that one of the women that's involved in that and kind of organizes it is also a faculty member at Lamar. So you'll see that faculty get really involved with a lot of these events as well. The Walk a Mile Iron Shoes event that we do as part of Sexual Assault Awareness Month, I get a lot of faculty and staff that want to participate as well. So that's a really kind of awesome piece to that, as I do partner and work with, or they just come out and they want to participate. The Lose Smart weight loss competition is something that we've done. So again, I like to focus on mental health and stress, and we do a lot of that. But there are people who want to just focus on, whether it's physical activity or weight loss or just eating healthy or the pieces that kind of go around that. I do that, and that competition is actually being revamped a little bit. And I'm gonna add like 2 pathways. So there will be, when you get around to that new year, kind of new you, and you're setting those goals and those New Year's resolutions, it's going to switch it up so that we're a little bit more inclusive for things outside of the physical wellness as well. And then the big thing that I want to show you guys, so this is a free resource. We actually pay for all of the Lamar students to have this. We want to make sure that you have access to health information at your fingertips at all times, and in a platform that's really geared towards students. And so we have Campus Well. It used to be known as Student Health 101. I pulled up, this is when you land on the page, this is what you're gonna see. You'll see that the first thing you see is this week in Campus Well. Those articles change every week. So there's new content for you guys every week. The cool thing though is that they actually switch this up, so it's more like blogs. So you can actually go in and see, past posts, some of the older content that they've got that's still really, really valuable and still useful. You can actually go and see. So if you clicked on Eat, for example, you can go back and see all the past recipes. They gear recipes towards something you can easily do in your dorm room. If you look at Prosper actually has some financial wellness stuff. So if you're a little worried about that, they've got that. Sleep, oh my gosh, I could get on a soapbox about sleep. And Shannon didn't necessarily mention that, but that's something, sleep disturbances could be even something that you could see them for. But there's information on that. And so I think it's really nice because it covers all of those dimensions of wellness that are really important. As well as things, we provide, and this website does a good job of integrating what's going on campus. So you can actually navigate some of the big announcements, especially things that maybe we're doing for our events are on here. I know that even the link to the Lamar COVID page is actually on here if you scroll down. And this is free. The cool thing is that this is now available in an app. So if you're on your phone, you can't do it right now. But I suggest once you get off of this webinar is that you go Google on your phone, whether it's the App Store or you're on your iPhone and it's the Apple Store, just search Campus Well. And all you're gonna do is you'll come up, you'll download it, and you'll click, oh, yep, I'm a Lamar University student, and now you've got access to this. Or we will send out emails, and then this is available the link is available on our website too. So there's a lot of different avenues for you to access this. And they've done a really good job of including articles related to COVID. So that's, you know, if you want to know how to navigate some of the articles that are out there, you know, the scientific articles or, you know, news articles for information, they did a really great, you know, blog post kind of on, you know, how you can read those and whether you can find out, like, is this valid information or not. So I highly suggest downloading this because it is available to you. It's free, and you can have access to it at all times. The other thing that I will say that's on this is they do have a self-care guide. So if you have something going on, like, you know, you get a cut or something and you're like, how do I take care of this? Like, how can I clean this? It's not something I need to, you know, go see Danette to stitch it up. It's just something where, you know, I like bumped into the wall, it's a scratch, but I want to take care of it, right? There's actually a self-care guide on here. You can go and look it up and it'll kind of walk you through the steps of how to clean it. So there's a lot of good resources on here. If you're like, yes, I'm going to become independent, and I'm like super excited about it, there's a lot of information and good information on here. So I highly recommend checking it out. And then the last thing, so I did tell you, I do have a program. It's Pure Health Education. We call ourselves the Healthy Cards. It's a paid position. The application goes live in October. And the reason for that is we actually hire for spring into fall. So it actually goes, it's a little different. We don't go by academic year, we go by calendar year. And the reason for that is that I will, in normal circumstances, you would meet a Pure Health educator at an orientation in person. But then when we get to the fall semester, we hit the ground running, and you will do a lot of programming really early on. They actually complete a certified Pure Health educator training, as well as I tap into the students to develop their own programming. So some of the programming that we're going to roll out in the fall is something that a former Healthy Card and a student who was also an intern for me actually created on sleep. And so I let students, if they have a topic and they want to run with it and they want to create something, I let them do that because, again, the reason we have this position is so that it's not only to give you guys an opportunity to do something that you're passionate about, which is a big reason, but it's also to really get that feedback from students who are on campus who are like, yes, this is a need for students here. So I highly recommend checking this out. Again, the application will go live in October and it is a paid position. So that's always a question I get. So if you're looking for a job, but also something that you're like, I want to put this on my resume, or, I'm just really passionate about health and want to teach my fellow students, this is the position for you. And so if you've got any questions on this, you can either go to my website, email me later. If you're like, you get to September, you're like, what was that position that she was talking about? Or, drop a question in the chat as well. So just a couple of things to kind of wrap this up that we want you to know. So at the Student Health Center, we strive to provide those low-cost services. So, a regular visit's going to cost $10. Counseling, $10 for a counseling visit is, let me tell you, like, ask anybody that is cheap for counseling. So take advantage of that while you're here. And then the services for medical just kind of depends on what you've got going on as well. Everything's by appointment. Especially in the COVID times, we highly suggest you call to make an appointment. Although normally sometimes people could walk in and make their appointment as well. I know some people still like to do that in person, and I value that in the age of technology. We also have the patient portal that can be used for scheduling and records. So say Danette mentioned, if you get blood work drawn, they'll actually put this in this private patient portal and they'll upload all of your results in there. And so you'll actually have, once they get it, instant access to all of that and you have it available to you. So just keep that in mind because that's a really useful thing as well. The university does also sponsor a PPO insurance plan through Academic Health Plans. All the information for that is going to be on our website, or you can call us. And if you've got a specific question about it pertaining to you, we do have an individual here who will happily answer all of the questions about academic health plans or just your insurance in general. Although I will tell you that we don't specifically bill. So if you do have questions on that, I highly suggest calling her, just because I guarantee you, if it's a super specific question, I would still have to tell you to call her. So I'm going to just be really upfront with that. But just so you know, if you have a question, please, I actually, I asked her before we did this. I said, do you have anything you want to add? She was just like, if they've got a question, tell them to call me, because she'll happily walk you through it. So this is just our information again. So that's it. So if anybody has any questions, feel free to put them in the chat so they can ask them.
Thanks so much, you guys, for that presentation. Yes, round of applause before we get to the questions. Thank you. Yes, you can always put them in the chat. You can unmute yourself and ask them verbally, however you prefer. Some events that you maybe have been thinking about or wondering if they do, or anything about their mental health services or stress, anything, please. They are here for you right now. Okay. If anyone doesn't have a question, well, please, I hope you wrote down that information. It doesn't seem like anyone has any questions. Y'all must have done a wonderful job presenting on everything, so not a bad thing. Oh, we do have one. They're processing.
I'm going to go ahead and answer that one live about the meningitis vaccine. The Minova vaccine is an NC4 vaccine. It is acceptable for your vaccination, so you can submit that one.
Good question. I know I got a shot done by the health center. It wasn't that scary. I had to get it for my teaching when I was a teaching major before I changed majors. So.
Oh, Bailey, I'm going to just jump in real quick. A lot of programs may want you to have a TB skin test. Sometimes that's hard to find. We do TB skin testing too. So just like Shannon talked about earlier, the different things we do. If you have a question, call us. Chances are we can take care of it for you.
Okay. And someone else asked a question, and it was, what is the cost range for medicines offered by the health center?
Okay, the medications that we have, the antibiotics, I will say they are very affordable. Generally, they start anywhere from maybe $10. I think the most expensive medicine we have, and we just can't help this one, is the Tamiflu. For people who have the flu, it is just an expensive medicine. It ranges close to $100, but that's just because of the medication, and it's not a very, for that. But anyway, they're very affordable, and you don't have to get your medicine from us. We'll be happy to write your prescription, and you can take the prescription to the pharmacy of your choice, or we can fax it for you.
I have something to add to that, and then I see this other question, and I can help that one as well. So the other thing that isn't mentioned here is that you don't have to come into the health center and have like cash in hand. So I mentioned that it's the $10 for the copay. This actually gets billed to your student account. So it's really nice that if you've got something going on and you want to come in and you're worried about paying for it that day, it is really nice that it goes on your student account, because it's just something where you're like, now don't let it pile up and don't be like, why is all this money on my account at the end of the semester? But just know that it's not something where you have to walk to another office and you'd be worried about having to pay $40 for a copay. So just kind of keep that in mind. And then I do see we have a question about having an admin hold on health insurance. So I know that it probably pertains to international students for the most part. But if you have an administrative hold for health insurance, I actually think you need to go through the international office. Danette, I don't know if you have any information on this, but I actually think you need to go through them, because you just need to make sure that you are, if it's international, you have to have the health insurance through the student health center that we were talking about, the academic health plans. Danette, do you have anything to add to that?
the health insurance, if they choose to have their own health insurance, it has to be comparable to what Academic Health Plans offers. But I do suggest he call here and talk with Ms. Carlisle, Kathleen tomorrow, and she can really answer that a little bit more. I don't know that I've ever seen this hold before. There's usually a lot of TV holds because we have TV documents, but she would be the person to answer that question for him correctly.
Okay, I have one more thing before we head out, and if you have a question, please continue to put them in there. And that is if any student is in here for the, I think this is where I'm cutting out. Am I cutting out? I'm doing okay. Okay, perfect. If any student is here for the little scratch checkoff thing, sorry if I'm getting my words mixed up. If you have your first and last name on your name currently, I have you down, no problem. But if you just have your first name, and I see like an iPhone in here, we do need your first and last name. That way I can check you off that you've been here and it's all good to go. So if you want to put in your full name, and if you don't know how to change your name, perfectly fine. You can unmute yourself and then say your name out loud, no problem. So we can take
Or
one.
drop it in the chat.
Or pop it in the chat. That works too. Thank you. Does anyone have it? OLs, while I'm doing this, do y'all want to share anything positive that y'all have gotten from any de-stress week or anything? Nothing too private, but.
Well, going to college, I recommend finding a hobby that you can do easily that will help you get the stress off your mind. Because especially since going to college, it's a different world. You have more responsibilities. So having something that can reduce the stress from all that will be really helpful for your career.
And I would just like to say about the de-stress week, I think even though it's not fun that it's like finals week, it's kind of the funnest times when it comes around. I really looked forward to looking at the dogs whenever it came to finals week, and I suggest that y'all really should go. It helped me a lot because I'm a person who stresses out a lot about anything, so it helped me. I went once in the set and then once in the library. I don't know if they changed locations at times, but they're pretty good at updating everything. So it should be really easy, and you can easily tell where the dogs are at. Everyone's just all huddled over there.
Yeah, they're very nice dogs, very cute, and they're very friendly, and we just lick you, make you feel good about yourself.
And also I remember once they were giving out like free shirts and like popcorn and coffee and all of that. That was also fun. I love free stuff, so anytime I see anything, I go for that. So it kind of took my head off of those exams for a bit.
And I'm usually giving out free stuff. So if you see me, come find out what free stuff I'm giving away.
Yeah, just hearing the word free just just takes away all my stress.
That is
I love free.
Posters that just say free, and then I'll get everybody to come. I will say this: if you're not a dog person, the group is really good about having the de-stress week cat. A cat sometimes as well. I gotta pop that in there because not this crazy dog lady like I am.
Wonderful events, wonderful people. I have everyone marked down. So I just want to say thank you to everyone that came today. I hope you learned a lot of interesting things, helpful things for your first semester at the university. It's going to go wonderful no matter what happens out there in the crazy world. So thank you so much to our presenters and our orientation leaders. And I appreciate you. So bye.
Well, thank you for being here, guys. Bye.
Bye, guys.
Bye-bye.